Government agencies are routinely making decisions that affect health. Public health professionals can have an impact in shaping these decisions by participating in the rulemaking process through public comments. A key opportunity to provide an agency with your real-world experience, expertise, and professional insights. Every day at the local, state, and federal level, government agencies are engaged in rulemaking, a process used to create and modify rules to implement public policy. We are focusing on the federal level in this video, but engaging with agencies is similar at all levels of government. Evidence-based rules have been instrumental in shaping modern policy wins, like environmental protections and food and drug safety. The comment period is the time the public has to submit input before an agency makes a final decision on a proposed rule. During this time, an agency will solicit evidence and feedback from experts, stakeholders, and the public. Agencies benefit greatly from your public health expertise during the comment period. You have the potential to influence policy outcomes, impact communities, and translate evidence into action. The rulemaking process. There are two main catalysts for the rulemaking process. Legislators may direct an agency to act on a particular issue, or an agency may prioritize their own issues or goals within their area of legal responsibility. Before issuing a proposed rule, an agency may gather background information through formal or informal research and discussions with relevant stakeholders. The proposed rule, or notice of proposed rulemaking, is the official document that outlines an agency's plan to tackle an issue or accomplish a goal and provides a time frame for public comments. A proposed rule begins with a summary of the issues and policy actions under consideration, outlines the authority to issue a rule, and provides information on why the rule is necessary. This is followed by details on when and how to submit comments. The agency will outline the reasons for the proposed solution, key data, and other information used to develop the rule. You will also find the full regulatory text of the proposed rule. To develop the final rule, the agency is required to consider all public comments, specific data, expert opinions, and alternative proposals to inform a solution that will accomplish their goals. Whether or not you are an expert on a particular topic or issue area, your unique contribution can help agencies create effective policies that also accomplish important public health goals and move the needle on the issues you care about. Your input can also prevent the adoption of a rule that runs counter to core public health principles. 10 tips for submitting effective comments. Let's walk through how to submit effective comments. Number 1, review the request for comments on the Federal Register website, federalregister.gov, for details on comment submissions. Begin working well before the submission deadline. Allow adequate time for information gathering, drafting, and revising. Number 2, take the time to read and understand the proposed rule you are commenting on. If you have questions or need clarification on the agency's request for comments, reach out to the contact person specified in the Notice of Proposed Rulemaking. Be polite and listen carefully. Number 3, avoid generic submissions. One unique, evidence-based public comment carries more weight than hundreds of form letters. Multiple generic statements in support or opposition have little to no influence on a final rule. Number 4, focus on the sections of the rule for which you can offer detailed analysis, evidence, and real-life examples to form a constructive or critical perspective. Address potential opposing arguments and agency justifications. Well-supported points are more likely to have an impact on the decision-making process. Remember, you do not have to comment on the entire proposal. The more direct and specific you are when addressing the agency's ask, questions, or language, the more likely your views and recommendations will be heard and considered. Number 5, clearly identify the issue or action that your comments address by referring to specific words, sentences, or paragraphs from the proposed rule and its justifications. Include page numbers, sections numbers, or other identifiers to link back to the proposal. Number 6. Respond to commenters with opposing viewpoints. With the online comment process, it's easy to read and respond to submissions from others. Only respond if there's something specific that is significant and incorrect. Number 7. If you disagree with aspects of the proposed rule, be sure to offer an alternative solution. Use facts and evidence to explain why your solution is potentially more practical and how it more effectively meets the agency's objectives. You can include points on unintended consequences, equity considerations, and implementation challenges to build your case. If the proposed rule includes exceptionally weak justification or flawed legal basis, you can suggest that it should be rejected entirely. Number 8. Establish yourself as a credible source early on. Identify your credentials and share relevant personal or professional experience that may distinguish you from other commenters. Number 9. Be aware of the tone of your writing. Avoid venting, foul language, and sarcasm. Agency personnel will not be moved by disrespect, and you only stand to hurt your credibility. Number 10. Edit and proofread your comments. Make sure your writing is clear, free of typos, and grammatically correct. For particularly lengthy comments, consider starting with a summary of your key points. All comments should follow agency directions for formatting, labeling, and submitting. Engaging in the rulemaking process is an essential advocacy skill for moving your public health issue forward. You have a unique opportunity to highlight critical public health challenges and call attention to impactful solutions. This is your chance to leverage your expertise and influence key decision makers. These tips can guide your approach to submitting effective comments that will lead to lasting change.